Good evening, students. In this session, we will discuss a case of medical sciences and we'll try to see how null hypothesis and alternative hypothesis are set while testing a medicine. Let's consider a null hypothesis where it is said the drug does not affect the growth rate of cancer cells, which means the new drug which we are launching, it does not reduce the growth rate of cancer cells. This is one hypothesis which is null hypothesis. Now we are saying that there is no connection between the drug and the growth rate of cancer cells. We are not saying that the drug is reducing or increasing. We are saying it is not affecting, that there is no relation, no connection between the two parameters. One is the medicine and the second one is the growth of cancer cells. So this is our null hypothesis. Now the other one is alternative hypothesis, and it says that the drug affects the growth rate of cancer cells. So the opposite of null hypothesis says that the medicine or the drug which is being launched, it will definitely affect the growth rate of cancer cells. So these are the two hypotheses which we are testing for a medicine to check whether a medicine is right or effective or not, and should we go about it, should we launch it or should we reject that medicine. So now we will see that we can see a type 1 error which can occur when we say that the medicine is effective and the current medicine is rejected. I repeat, if I am saying that the current medicine is rejected on the basis that the new medicine will be more effective, which is not, then I'm doing a type 1 error. Why? Because the current system where a particular medicine which is already prevailing in the market and medicine is curing the patients, and I stop that medicine and I introduce a new medicine which is ineffective. So in that case, what I'm doing, the major population, what it was saying that the drug is not affecting the growth rate, is rejected, and I'm imposing my hypothesis that the drug is effective. So researcher is imposing his hypothesis and rejecting the null hypothesis which was actually true. So I'm doing a blunder over here and I'm committing a kind of type 1 error. Now, as we know the two hypotheses of the case, we come to know that after applying the drug to the cancer cells stop growing. Okay, so this is a scenario that I applied the new drug and the cells stopped growing. This would cause the researchers to reject their null hypothesis. So now, since the cancer cells are not growing, so the researchers will say that we should reject our null hypothesis now. Why? Because the drug is actually effective, and it is if you apply that new drug, the cancer cells are not growing. So what researchers are doing, they are rejecting their null hypothesis that the drug would have no effect. What was the null hypothesis? Just read it. The drug does not affect the growth rate of cancer cells. So this was our null hypothesis, and now the researchers are rejecting it, saying that the alternative hypothesis is correct. So this is the scenario. Now again see, if the drug caused the growth stoppage, the conclusion to reject the null in this case would be correct. So if we are saying that actually the growth stopped and the reason was that medicine, then if I am saying that the null hypothesis is not correct, and we can reject it. So it is a right decision. But now listen carefully. If someone else during the test, something else during the test caused the growth stoppage, which means some other reason was there, instead of that administered drug or the new medicine, some other reason was there which caused the growth stoppage of cancer cells, this would be an example of incorrect rejection of the null hypothesis, which means we are creating a type 1 error, that the alternative hypothesis is false, but we have accepted, and the null hypothesis was correct and we have rejected. So we have to be very careful when we are doing sampling and we are doing the experiments and the results. We have to actually find out what is the right what is the right way of doing the sampling. And if we have done one sample, we can go with multiple samples and we try to bring the result near to the mean, so that the mean comes into the acceptance area. We will see some more examples of such kind of null and alternative hypothesis with type 1 and type 2 errors in the coming videos. Thanks for watching the video. Good night.